I'm Dr. Cheryl Watson-Lowry, and I'm honored to be here today representing the Chicago Dental Society and the Illinois State Dental Society as we highlight National Children's Dental Health Month and bring attention to the oral health crisis here in Cook County. While February is National Children's Dental Health Month, the fact is our children are suffering because of the cuts that already have happened to the neglected and underfunded dental programs here in Cook County. The problem is it's only going to get worse. As people here in Cook County continue to lose their jobs, they're finding out the governmental dental programs available are basically non-existent. As an example of how serious this problem is here, last year alone, Illinois dentists donated more than $80 million of care to thousands of patients here in our state. It's the patients that had nowhere else to turn. In 2010, the Illinois State Dental Society staged a 2-day free clinic in central Illinois with volunteer dentists, hygienists, and staff. There was an overwhelming demand for dental services, with people camping out overnight, and the people stretched for blocks, waiting overnight in pain and some in fear that they couldn't receive the services that they so much deserved and needed. Dentistry is a very giving profession. However, charitable dental care is not the solution to a viable healthcare system. In 2005, half the dental clinics here in Cook County were closed. So there are now 4 dental clinics serving more than 2 million suburban residents, and there's no Cook County dental clinic in the Chicago area. These situations are worse because none of these clinics treat public aid patients. Now, we're not talking about trying to get the perfect smile for patients. We're talking about neglect. We're talking about long-term life health implications. There's been shown to be an undeniable link by the Surgeon General's report on documented oral health problems linked to general health. Situations like sinus infections, ear infections, diabetes, heart disease, stroke, just to name a few of the serious health conditions and costly health care conditions that exist because of poor oral care. And for our children, poor oral health has been proven to impact their confidence, their self-esteem, and also their ability to excel in school.
Good morning. My name is Peter Silvestri. I'm a Cook County Commissioner for the 9th District, which is on the northwest side of Chicago in the near northwest suburbs. Very honored to be here today with all of you to talk about this very important topic. And I'm very pleased that we're joined by my colleague, Commissioner Gaynor, and that our efforts are being joined by President Preckwinkle herself. The federal government has designated Cook County as a dental health professional shortage area. That means that we are not providing adequate resources for our residents to obtain quality dental care. Of the 2 million Illinoisans enrolled in public aid, 1.4 million of those people live in Cook County. Given unemployment and the downturn in the economy, more and more children and adults are looking to us as the last resort to provide health care, dental health care. I introduced a resolution asking the Cook County Department of Public Health to inventory its past and current practices, and you will find that report is in your press kits. The study makes it clear that our clinics have limited resources, and the 4 clinics that are open only to suburban residents don't come close to fulfilling the needs of all Cook County families that are looking for this service. The report further shows that in 2000, the Department of Public Health for Cook County served over 11,500 patients. In 2009, they treated less than 5,000 patients. The average wait time to get into a clinic in Cook County is 2 to 3 months, and we are only able to offer basic procedures like cleaning and fillings. Anything else gets referred to Stroger Hospital's oral surgery or the University of Illinois Dental School at Chicago, where patients become frustrated and worried because it's likely they will have to wait another 2 to 3 months for treatment. At that point, many patients end up in our emergency rooms, which end up costing taxpayers exponentially more money than if a comprehensive dental program was in place. The system is overwhelmed. We need to look at existing resources and figure how we can maximize what we already have and look at bridging the gap for those families who don't have access to dental care. Through our creation of an independent health board, it's very timely that we are now looking at how to reorganize how we provide health care in general, and dental health care has to be part of that priority. As a county board member, I can tell you that we have to tighten our belts, there's no question. Our dental program is hanging by a thread, however, and at the end of that thread are the Cook County families who are being turned away and being left with no options. I would like to applaud the Illinois State Dental Society, the Chicago Dental Society, and the Bridge to Healthy Smiles Coalition for their eagerness and willingness to work with us to find a viable solution.
Good afternoon. My name is Bridget Gaynor, and I represent the 10th District, which is this area of Uptown and also the North Lakefront and Northwest side. You know, when you think back to being a kid, you probably think, God, being told you couldn't go to the dentist was probably a dream. But when we went out and interviewed hundreds of people in this neighborhood over last summer and asked them what was the biggest problems they had in their ability to get medical care, the number 2 problem, right under mental health, was dental care. And this affects children and families. And the idea that as a child you have a major dental problem and you can't get to the dentist turns into a nightmare for these young people. It leads to many other health problems, and we've heard that over and over, but it becomes, to Commissioner Silvestri's point, something that really interferes with their general health and their ability to be productive young people and enjoy their lives. So we took this step to go out and find where are the clinics, where do people go for care, and we realized that in this part of the lakefront, even when you have tons of providers, active business districts, seemingly a very healthy economic scenario, you look around and the vast majority of people in this neighborhood have to leave this neighborhood to get dental care because they can't afford the dental care that may exist here, and clinics that accept Medicaid or Stroger Hospital or the public clinics are very far away. So we want to come together with the Chicago Dental Society, the Illinois Dental Society, this clinic here at the Boys and Girls Club. Not only, as the doctor mentioned, we can't rely just on a charitable solution, but we want to engage our corporate partners. We want to make sure that dental care remains available through the Cook County system and also the other public systems and federally supported clinics and care. So we are going to work together with all of these partners, and I would call all of us to call attention to an issue that on the health side often gets forgotten, but is very important to people's ability to be productive citizens, especially young people. So thank you very much for being here. Thank you for hosting us. And thanks to the Boys and Girls Club.
Research has shown that 80% of caries is in 20% of the population. The lower the socioeconomic status and the younger the children are, results in higher rates of caries. Higher rates of caries have been associated with substantial pain, overactive immune systems, significant time missed from school, parental time missed from work, lack of nutrition due to pain, lack of proper height and growth development, underdeveloped brain sizes, and negative effects on permanent teeth. Furthermore, we see significant self-esteem and confidence issues. Caries in expecting moms is even related to preterm and low birth weight infants. Due to minimal funding available and the lack of offices who accept Medicaid, we are seeing many parents of pediatric patients opt for only services and procedures that are covered by their insurances. This translates into patients ranging as young as 6 years of age having permanent tooth extraction as opposed to restoration. Parents have voiced their absolute pleasure with reopening the office. Many have been very thankful and even brought to tears. Many haven't received treatment or care since 2009 and have been living with pain and infection or abscesses and missing teeth. Furthermore, parents are bringing along other members, friends, and colleagues from the neighborhood. We have even seen children from neighboring homeless shelters. One child in specific that comes to mind received 18 primary tooth extractions of only 20 primary teeth in the mouth. Mom is happy to report that the child is eating and sleeping better than he ever has, stating that he eats everything on his plate and theirs. He has performed better in school and has even gained significant weight. We have made some big strides over the last several years dealing with the caries epidemic by having different dental initiatives by different associations. However, we're starting to see a significant step back. It is important to keep moving forward towards establishing comprehensive dental homes for the underprivileged children in our community.
Good morning. My name is Jamila Lawrence, and I live in Bronzeville with my 2 children, India, who is 13, and Caleb, who is 4. I am a single mother who until 2 years ago had a good paying job with benefits, including dental insurance for my family. Growing up, my parents instilled in me the value of taking care of my teeth. My sisters and I went to the dentist on a regular basis. I am thankful for that, and I would like to be able to provide the same opportunities for my children. When I lost my job, it became necessary for my family to rely on public dental insurance. It was an unpleasant surprise when I learned that clinics are scarce and they do not take patients on public aid. I feel like I am bouncing from doctor to doctor, constantly getting the runaround and hitting roadblocks. The city of Chicago does not operate dental clinics, and Cook County does not have any near my home. In addition to the long traveling distance, there can be a 2 to 3 month wait for care. If my daughter needs anything more than the basic filling, the providers are unwilling to service us because basic care is all the doctors have resources for. That is not dental care, and it certainly is not right. It seems that dental programs are last on the list of priorities, but what our policymakers and lawmakers do not realize is that people just like my family and me are suffering because we do not have access to good dental care. It is a frustrating, painful, and stressful position. Before my children begin a school year, they are required to get a dental examination. I agree with that concept because I know that taking care of your teeth is just as important as getting a checkup with your physician. The reality is there are not enough adequate resources to treat our children. The dentists that are recommended by the schools are overextended and do not have the capacity to see all of the kids before they go back to school. Everyone should have the opportunity to have healthy teeth and a nice smile. Yet it is so much more than that. It is children being forced to suffer the pain of a toothache or an unnecessary extraction of a tooth, a procedure that could have been prevented. It is children growing up feeling insecure about smiling because their teeth look bad. It is children not developing routine habits to properly care for their teeth and being able to take pride in having healthy mouths with no cavities. There are a lot of parents just like me, affected by these difficult economic times and trying desperately to keep it together. Dental care is not a luxury. It is a necessity, and until that is understood, our children will continue to be at risk for serious short and long-term oral health problems which can lead to other health issues. As a parent, that is simply unacceptable. I am asking everyone here to please work together so that families throughout Cook County can receive the dental care we so desperately need. Thank you.
Hi, my name is Ann Clancy, and I'm the director of the Chicago Community Oral Health Forum, and I'm here on behalf of the entire Bridge to Healthy Smiles Coalition. This coalition represents a diverse group of stakeholders who believe, as I do, that Cook County needs to do more to address the growing needs of its residents who rely on public and government health care. We have a broad membership that works to increase access and the public's awareness that poor oral health affects overall health. Oral health is more than just a pretty smile. It's about having adequate ability to chew, speak, and keep our mouths completely disease-free to aid in the health of the rest of our bodies. I'm also sure it's fair to say that everyone here has a child in our lives that we don't want to see suffer. I personally have seen firsthand extensive and painful dental conditions in many third graders in Chicago. These school children that live daily with painful dental infections have difficulty concentrating, have lower self-esteem than their peers, test poorly, and tend not to eat an adequate diet because it is hard for them to properly chew their food. Untreated dental infections in children have led to hospitalizations, seizures, and even death. This problem is not limited to children, however. I have also witnessed firsthand severe, neglected dental infections in senior citizens. It's sad when I have to tell them that their neighborhood clinic is closed to new patients. I urge Cook County to consider doing right by its residents and begin to address